Welcome to the Sound of Ideas. I'm Stephanie Haney. Thank you for being with us. If you're a millennial, you probably remember things like dial-up internet, flip phones, and being told that education was the key to stability when you were young. Then, adulthood arrived for people born between 1981 and 1996, along with the Great Recession, student loan debt, and a job market full of uncertainty. These could all be contributing factors to why this generation of people reports higher levels of anxiety, depression, and burnout than those before it. But not everyone who experiences mental health issues is willing to seek out help, particularly men. Some mental health professionals are hoping to reach and treat reluctant men, particularly millennial men, where they are. Today, we've invited experts on to explore what mental health challenges this group is experiencing and what meaningful change could look like. Joining us for the conversation today, we have Walter Patton, Executive Director of Ghetto Therapy. Walter, thanks for being with us.
Thank you for having me.
We also have Dr. Neil Parekh, Clinical Assistant Professor of Urology at the Cleveland Clinic and Program Director for the Urology Residency Program at the Cleveland Clinic Akron campus. Thanks for being here, Neil.
Thanks for having me.
We also have Jessica Vasquez, Prevention and Wellness Manager in the School Health Program Department at Metro Health. Jessica, thanks for being here.
Thank you.
Joining us on the phone, we have Jake Ross, licensed independent social worker and owner of the Ross Wellness Group. Jake, thank you very much for being a part of the conversation today.
Thank you for having me, and sorry I can't be there in person with you all.
We appreciate you making the time over the phone. That's why we have that option, so thank you. And we have the option for all of you listening and watching to call in on the phone as well. If you have a comment or a question, that number is 866-578-0903. You can also email us. That email is soi@ideastream.org. And you can send us a message on Instagram. We are at The Sound of Ideas. Jake, we'll start with you. We'd like to learn about your practice, the Ross Wellness Group. Is it millennial men that you're particularly serving or a wider range? Tell us about the clients that you serve.
Yeah, really focused on empowering millennial men to kind of look at themselves, decode their stories, and what I call fine-tuning their operating systems. Learning how they think, how they react, and how they connect so that they can really consciously shape the relationships in their life and manage that stress, that overwhelm, and that anxiety that we're referring to.
So, Jake, why is it that you decided to narrow in on that particular demographic for your practice?
Yeah, well, first and foremost, I'm a millennial man, so that really resonates with me. I am a new dad. I've got two kids under 5, and I realized when they got here that this whole fatherhood thing added a whole new layer of stress. So I empathize with that as well. I started in my career working in residential treatment facilities with adolescent males when I was an adolescent. So I also realized that population that really got me into social work and mental health has now grown up because I've been doing this for 20 years. So all of those reasons have kind of culminated in me really focusing on the millennial male.
Mm-hmm. Fatherhood is a theme that I think we'll be talking about a bit, and parenthood today in general. And just to do a little math for everyone, we're talking about millennials being born between 1981 and 1996. So we're looking at people who are between 30 and 44, 45 years old, in case you're not as good at math in the morning as that's the case for me. I was running the numbers here as we were talking about this. Okay, so Neil, as a urologist, can you talk to us about some of the mental and physical barriers behind men postponing visiting the doctor in general, not necessarily specifically mental health related?
Yeah, definitely a very common issue in medical field in general. I think there's a couple of reasons behind this. One is there's a cultural reason. A lot of men feel that they need to be providers, they need to be caregivers, and they feel they need to be stoic, and so they don't tend to want to show any weakness. So that sometimes makes them reluctant to come to see a medical provider or get help. And they don't want to be complainers. Oftentimes, I find that it's actually their partners that are the ones that are forcing them to make the appointment or coming with them to their appointment and even making their appointment to see a medical specialist. And I think for a number of those reasons, that's what's challenging. But it's definitely great once they make it in.
Sure. Can you break down for us? I know this is a wide-ranging question to ask, but what are some of the risks of not being proactive and taking that step and getting into the doctor?
Yeah, as a urologist, I'm specialized in men's health and male fertility. One thing that I commonly see in my practice is sometimes sexual dysfunction. Things like erectile dysfunction or ED can be a precursor to a lot of other medical issues, and sometimes even just mild symptoms can be a sign of an underlying issue like high blood pressure, diabetes, high cholesterol. And sometimes that's what brings patients or men to the office, is something going on with their sexual function. And as a urologist, we really try and dig into any other underlying medical causes or side effects of medications or different causes that could be causing some of those issues.
Our bodies do have a way of letting us know what's going on with these physical manifestations, for sure. Walter, let's talk about your business now, Ghetto Therapy. Tell us about the monthly programs that you offer there.
So Ghetto Therapy is a free and open to the public mental health group therapy session, a service that I started back in 2018, but in 2021 we started to go every week. So we missed about maybe 4 Wednesdays, especially this year due to the snowstorms. But in the last 5 years, so every Wednesday from 6 to 8:30, you can come to a group mental health therapy session where we utilize EMDR, eye movement desensitization. We utilize Reiki, focus on body chakras. We utilize sound, meditation, yoga. We utilize about 7 forms of therapy for free. And our specific target is in impoverished communities that we consider the ghetto, right? So that's what we do on a weekly basis. And it's been going on for 5 years. We have every first Wednesday is men's night. Second Wednesday is youth night. Third Wednesdays is women's night. And fourth Wednesdays is like an overall family night facilitated by Maisha Watkins.
Okay. You mentioned a couple different types of treatment there. So can you explain to us, I'll ask you first about EMDR, what that particular treatment is and how that works.
So it's kind of like a cognitive therapy that gets you focused on like one track minded. It's like my son, for instance. He's this kid who wants to go to the movies. We take him to the movies, then 5 minutes into the movie, he wants to go to the playground. He want to play. So EMDR is kind of focused to get you, it's kind of set to focus to get you on one track minded of a thing. So it's like a hypnosis kind of a thing as well. So EMDR is something that we utilize, but not much as the other therapies. But it is a good cause, like for our kids especially. So it's like one track minded type of thing.
Okay. I've read a little bit about this, and from what I understand, you're sort of recalling imagery and then moving your eyes in a certain way to kind of retrain your brain to respond to things in a different way. Does that sound right?
Yes, just staying focused on one specific thing at that time.
Okay. And what about Reiki?
So Reiki is my favorite. It focuses on the body chakras. You have like 7 different body chakras. And the colors itself, like the red is the root chakra. And the focus like on the lower back area, right? So that's my favorite one of all time. It's like massaging toxins out of your body through your chakras. So I love Reiki therapy. That's actually my favorite.
Okay, you said massage. That sounds good to me. I'm up for
Yeah.
that, right? Okay, so what prompted you to start Ghetto Therapy, Walter?
So I don't know everybody really probably know that I'm not a therapist, right? At all. I get a lot of calls, DMs, as if I'm the therapist itself, and I'm not. But as a resident, I seen an urgency because I live in a central community. The public housing, as we call it, down the way projects, where you see a lot of homicides, drug abuse, alcohol abuse. You see a lot of these things. So I saw the urgency to create a safe space for our residents in that community because a lot of trauma happens every day inside of communities of poverty. When you don't have a grocery store for 7 years, when the hospital is closed, you have 8 prison-based facilities surrounding 1 high school. There's needed to be spaces to combat those issues because those are structural issues that we may not be able to overcome without these kind of spaces like ghetto therapy.
Okay. Now, Jessica, Walter mentioned working with youth there on a particular Wednesday. You also work with youth. So can you talk to us about peer-to-peer mental health awareness program and how that came to be here in Northeast Ohio?
Yeah, so P2P is a prevention program, so it focuses on mental health awareness as well as suicide prevention. And so that program is out of the University of Michigan, and it came to Cleveland through a grant that was provided to us from a family in honor of their loved one. And so their belief was that if more adolescents and youth were able to have a better understanding of mental health and were able to better support their peers who may be going through it, they feel that that could make a really positive impact. And so in choosing P2P, it was very intentional because the program is set up for peers to get certain types of mental health like knowledge and information, and then those peers create a campaign for the rest of their school where they're seeking to reach the goals of increasing mental health awareness amongst their peers, reducing stigma associated with mental health, as well as encouraging help seeking and really bringing all of those resources to their peers' attention.
Okay. I understand the peer-to-peer program has been active for 3 years here in Northeast Ohio. Is that right?
That's correct. We started at Richmond Heights High School, and then we expanded to Richmond Heights Middle School, as well as St. Martin de Porres High School, and are currently on track to continue expansion across the next few years.
Okay. So how many schools are you currently in, and how many students are you serving right now?
Currently, we're in we have three programs across the middle school and the two high schools, and our members are we're at like about 60 members across those programs, but I would say the impact of it is across probably closer to 1,500 when you take into account, our student population and the exposure that all of the peers at the schools get to the peer-to-peer campaign.
Sure. That's how it starts, right? Someone gets invested, and then word spreads, and people get interested. I want to remind our audience that we are talking about mental health and particularly reaching people who might be reluctant to seek treatment for mental health. We're talking about the demographic of men. We're also talking about the age group of millennials. The phone number to call in if you have a comment or a question is 866, H is not a number, 866-578-0903. And the email is soi@ideastream.org. We do have a call now from John in Lima. It's a medical related question. John, go ahead.
Hi. This has always kind of puzzled me, but in May of '93, my grandfather was diagnosed with what I call beyond terminal kidney cancer. But in the workup of things, the urologist did a prostate exam on him. And he said, you've got the prostate of a young man. He said, there's no swelling, no irregularities, no infection. So the only thing I can lay it to is that maybe it's the different areas. And I was just wanting to get your urologist prospect on, take on that.
Go ahead, Neil.
Yeah, no problem. Yeah, the prostate is obviously can be an issue for many men as they age. And in your grandfather's case, in the 90s, physical exam was definitely one of the ways urologists try to check the prostate for any lumps, bumps, any concerns for cancer. But the prostate, is different for everyone, and there could be different drivers of prostate growth and issues with prostate cancer. And there are a lot of theories. And right now, there could be lifestyle issues, environmental factors, genetic or family history. There are a lot of factors that come into play that can drive issues with the prostate. So it doesn't necessarily have to affect everyone the same way.
Thank you for calling in, John. We got an email question now from Rich. Rich is asking, is there a higher degree of alcohol use among millennial men? Jake, I'll direct that question to you since your practice area of focus is specifically. Do you see a high degree of reporting of that among the clients you're serving?
Yeah, it's a great question. I wouldn't say it's a high degree. It's interesting that I believe that this generation turns to other substances. I'm in Ohio, and of course, marijuana is now recreational legal. So I would say I end up with guys that might indulge there more than they do on the alcohol side. But yeah, I can see the concern, and I definitely know that we grew up at a time that we were doing a lot of the drinking and partying, but not a lot of my guys' primary issue, although it might be a negative coping pattern that they are holding on to.
Okay. So let's talk now about some of the issues that we're seeing among the groups that serve here. Jake, I'll stay with you for just a moment. What are some of the issues that your clients are coming to you with to try and work through?
Yeah, I mean, I mentioned, fatherhood, and I think for me, my daughter got to the hospital, came into this world, and I was just overwhelmed with this new sense of anxiety of looking back on how I was raised, looking back on how I was impacted throughout my life, and realizing all that's on me. I think that we've kind of been handed this new world, right? We're one of the first generations that had stimulation in our pocket all the time, that we can find information anywhere at any point. And we never really had the playbook for how we manage this, right? I I also talk about this, what I call the man plate. I think me as the dad in my family, I want my kids to know that I'm here for them to provide for them and to protect them, but also to be their emotional support and to be present. And I don't want to talk poorly about my dad or the dads of previous generations, but I don't think that they had that expectation or that intention as much. But we didn't drop anything off of our responsibility plate while we picked that one up. So it's a lot of overwhelm and not understanding that when I'm overwhelmed, I'm not emotionally regulated and then I react poorly.
Jessica, what are you seeing among the young people that are working with the peer-to-peer program? What kind of issues are they trying to cope with?
For our youth right now, they're coping a lot with different forms of anxiety. So there's like general anxiety. You have youth who are suffering more from social anxiety. A lot of our students also are feeling a high level of pressure from all areas of life. So they are feeling pressure academically, simultaneously as their anxiety over their future. So it's like I have to focus on what's on my plate now in school, but I'm also thinking about college or what's after high school, or am I going to be playing sports? And that's more for our high school students. A lot of them also have more pressure coming from maybe their family life and some challenges that may be going on in that area. And overall, amongst our younger adolescents as well as our older teenagers, we consistently see challenges related to their peers, with different like relationships and friendships and bullying and peer pressure. So a lot of those areas that are related to like their social life are a big focus for them, and any challenges in that area are the ones that I notice that they're often coping the most with or trying to cope the most with.
Do you notice anything, Jessica, in the work that you're doing about students related to phone use and social media influence?
The positive side of that is that our schools have a no cell phone policy that's been put in place, and consistently we're hearing from other educators things that they're seeing in the classroom that's an improvement because our students don't have their cell phones in their hand all day or easily accessible. I have personally heard from students that it has helped them to feel calmer throughout the day. They're more able to focus. And so I think because of forcing not having cell phones, they're then realizing, oh, there are benefits. I don't think that our youth are in the position where, because of everything they do on social media and online, I don't think they're going to come out and say, oh, yeah, this probably isn't a healthy level of use. But when you put them in a position to experience what it's like to not always have their phone on, not always be on social media, they see the benefits. And because of how much is shared on social media amongst that group that a lot of us millennials did not go through in our teenage years, things can change very quickly. Something's posted, you find out in the middle of school, and then that will take over their feelings, their ability to concentrate. So I think that as schools get more strict with that, we're seeing a really positive benefit to our adolescents.
I remember when pictures got added to Facebook, my mind was blown. I was like, pictures on Facebook? What is this, MySpace? What's going on? I don't understand what's happening here. Jessica, I want to ask you one more question about this on this particular moment. So it's a mentoring role that students are in the peer-to-peer group. Are you seeing, is there a breakdown that's different between female and male students taking on the role of mentor?
What's actually really, really awesome at our first site, which is Richmond Heights High School, we realized after our student group was recruited that the majority were actually boys in our school. So that group represents a higher level of boys who engaged in the peer-to-peer program. So we refer to our P2P members more so as mental health advocates to their peers. And so we've seen boys share with us that like, oh yeah, I didn't have the right idea of mental health. I was carrying stigma. And because they just decided to get involved, because maybe they thought it was just a cool club or a leadership opportunity, in the end, when they've been interviewed and surveyed, a lot of them are sharing how much the program has helped them gain more information about the seriousness of mental health. Because some of the things that were shared today were that a lot of men do carry that perspective that, oh, I just need to like tough it out, be stoic, not really show that anything's bothering them. And we're seeing that in our adolescent boys, that some of them hold that mentality that, oh, I just think people are making a big deal of nothing. And then now they're understanding, no, these are like real medical illnesses. They are treatable, but they're indeed real. And so that has shifted their perspectives and the stigma that they had against mental health in the right direction that we want to see the change go.
Okay. Walter, what about in the community that you're serving at Ghetto Therapy? Are there common themes that are coming up among the people that get treatment there?
The biggest thing that comes up and the thing that we focus on the most is our environment around us, because we know that our environment dictates our life expectancy, right? So there's this study in Place Matters, Cuyahoga, that says the residents in Lyndhurst live 24 years longer than the residents in the Central and Huff community, and it's due to our structure issues. So the things that we talk about the most inside of the therapy service, outside of the structured facilitated sessions, is creating a longer life expectancy inside of our community. As I said, when we don't have a grocery store, it's just considered to be a food desert. And we have a very high infant mortality rate at 22%, and that's just babies dying before the age of 1. So it's all about creating a longer life expectancy inside of Ghetto Therapy, and those are the things that we focus on by tackling issues like lead poison. Now, I was once the events coordinator for Lead Safe Cleveland for 4 years, and we know that every home that was built before 1978 possibly have a trace of lead in it. So we also have that resource inside of Ghetto Therapy as well, and we partner with Cleveland Clinic Langston Hughes as well. So they provide the free yoga room for our residents inside of the Ghetto Therapy. So we just focus on a longer life expectancy because we know our environment dictates how long we live.
I want to remind our audience that we're talking about mental health, and we're talking about reluctance to seek mental health services. We're talking about this particularly in the group of millennials, but in general, and also kind of honing in on the group of men and what are some unique challenges and maybe stigmas and obstacles that are kind of preventing people from seeking that help. So if you want to be a part of this conversation, the number is 866-578-0903. You can email us at soi@ideastream.org. Now, on the topic of stigma, our coordinating producer, Drew Mazius, talked to Kenny Kearns, a mental health clinician and addiction counselor. So here's what Kenny had to say as someone who both goes to therapy and provides mental health support to others.
If I'm in a position where somebody should get therapy or would benefit from some form of therapy and I suggest it, the first thing they say is never, I know. It's never, oh yeah, where do I go? It's just like it was for me. You get this like whirlwind of thoughts about how your parents didn't do it, about how TV hated it, made fun of psychiatrists, media just didn't like it. So vastly different from our childhood growing up. And, for a while now, it's been different. It's far more accepted, but people our age, my age,
More accepted among people in the age group. And Kenny is 40, by the way, so he is in this millennial group. Neil, I want to ask you, when patients are coming to you and they're presenting with whatever physical issue it might be, how often is mental health a part of the conversation in your treatment plan?
Yeah, it's a great question. Sometimes men, you would imagine, would be reluctant to kind of share some of their personal details that are going on in their lives. But, as a urologist, as a medical specialist, our job is to try and make patients as comfortable as possible. And oftentimes I'm sometimes surprised at what they are willing to share and what they open up about on their first visit. But in certain cases, some patients are more reluctant or may be more uneasy to share some of those details. So I'm always quick to try and offer other support services like mental health services. We have great virtual therapists at the Cleveland Clinic that are easy for our patients can meet with virtually. It's convenient and allows them that privacy. But I also try and emphasize the importance mental health can play in the role of men's health. We know chronic stress can elevate levels of cortisol, can cause vasoconstriction of the blood vessels. All those things can cause issues with erections, libido, and drive. Same thing with anxiety. Anxiety can affect all facets of a patient's life, whether it's poor sleep or depression. All those things can have an effect on their day-to-day.
This is a topic that I want to ask the panel to respond to, and I'll start with you, Jake. The concept of toxic masculinity. This is a term that we hear a lot in common conversation, and I'm just wondering if any of the people that you have experience with in your different practice areas and your different groups and organizations are bringing up the concept of what it means to them to be a man and what it means to be manly or showcase your manhood or be a good man and how people are parsing that. So, Jake, I'll start with you in your practice with millennial men. Does that concept come up?
Yes, 100%, and it comes up early. It's often comes up in that consult call or in our first call, just as we're talking about what therapy is and how it goes, that it feels weird because I'm thinking I'm not masculine enough, and what I challenge guys to do is define what's masculinity, right? And I pull up the Merriam-Webster definition that says it's the qualities of a man, and then we start talking about what those qualities are. I think in our society that is strong, right? That is, I heard that stoic word earlier from another panelist. It's not acknowledging what we're going through because we got to keep pushing through, right? But I'm turning that on its head. I've got a 18-month-old son, and I hope that when he grows up, he knows that masculinity is being okay with not being okay, knowing to ask for help when you need it, knowing that it's important to talk about what's going on with you, and that being the strongest or the toughest or knowing that you could beat up everybody in the neighborhood is not what defines you as a man.
Walter, what about for you at Ghetto Therapy?
When I think of toxic masculinity, and just I always speak from my experience, right, in the environment that I serve as the demographic, it's like mastering your emotions. I think a lot of the times as men, we don't value emotional intelligence, right? So it's like one emotional decision for 20 seconds can get you 20 years in prison. But the minute that we start to master our emotions and start to think before we actually react, that's the time where the toxic masculinity decrease, because we don't have like a control over our emotions. And emotional intelligence is also something that we talk a lot about at Ghetto Therapy, because we must control our emotions in order to be successful. In order to do anything in life, you must control your emotions. So I think toxic masculinity starts with emotional control.
Okay. And with the young people, Jessica, are you seeing that conversation come up, reaction to such a wide-ranging conversation that's been part of the public dialogue about toxic masculinity?
To be honest, amongst our youth, we don't often hear that term, but I feel like when you think about how that term has been described or examples that have been given, I do know that our youth are exposed to it, and they're also in their language as teenagers and in their perspectives and understanding, they are aware of what that may look like. And similar to what Walter shared, what we would witness, amongst our adolescents is that poor level of like control over their emotions. And at their age, a lot is happening with their hormones and, trying to control all of that. And also they're at that age where we're constantly trying to support their emotional awareness of themselves, and linking that to their behavior. So that's something that I would say at the adolescent level, we're working on early on, so that as young men, as young adults, they're not in that position where they don't know how to control their emotions, where the only way they solve problems is through anger or through shutting down or through, physically being aggressive in any type of form. And also at the teenage level, something that's been on the rise as far as an important area to address with youth is teen violence and dating. And so that's something that, although our program right now doesn't specifically focus on, we do connect resources to our youth in that topic, because at this age, we do want them to be engaging in healthy behaviors and be able to, manage their emotions, and as well as not engage in any physical violence.
Okay. And Neil, for you in your practice in urology, the concept of masculinity and toxic masculinity, does that come up at all?
Yeah, unfortunately, I see it on a daily basis. We touched on the effect of social media we have on young adults, and I think there are a lot of unrealistic expectations for young men out there. And just on my drive up here to the studio, I was listening to sports radio, and there are a lot of targeted ads targeting young men and kind of pointing out the necessary treatments and all these different ideas that they can take this pill or take this injection and they're going to be more of a man. And so as a fertility specialist, I see all the negative consequences of testosterone abuse, anabolic steroid use, and that's definitely becoming more prevalent in the Gen Z and the millennial population, in my opinion. And these men are not counseled on the negative effects that taking these medications, these drugs can have on their future fertility, their ability to have children in the future, and their dependence on these medications for the rest of their lives.
Speaking of children, we heard Jake talk about how being a father had impacted his feelings on mental health treatment and approach to it. Neil, has that had an impact on the services that you provide?
I have two boys. They're 9 and 6. They're very active. So they are a constant reminder to me to try and lead a healthy lifestyle. In the office, probably once a day, I have a patient tell me, Dr. Park, it sucks getting old, or you don't want to get old. Oftentimes there are a lot of medical comorbidities that are limiting patients' ability to do all their day-to-day activities or things that they hope to be doing at that age. So really that motivates me to stay healthy and also try and lead, be a positive example to my children as far as exercise and diet.
And Walter, you also mentioned being a father. So can you talk to us about how that's impacted your experience with getting your own treatment and just personally starting ghetto therapy?
Yeah, I'm a father of 4. I have 3 young boys, and I have one adult daughter. She just turned 21, and she's having a baby herself. I think one thing that I missed in the beginning was that that the access to a father is very important, right? And a lot of the times when you see the toxic masculinity thing come up, it's because these young men are being raised by single moms, right? And there's no knock to single moms because I was raised by one. But the outcome of a conflict can be different if a man is in that household versus just a woman in that household. And you will see someone react differently that's raised by a mom than having both parents and a father in that situation. So a lot of the times the toxic masculinity piece does come out because they're raised by a single mother and not having access to a dad. And that's one of the pieces that I wanted to touch on as well, is not having the access to a father and being raised by a single mother as a young man can dictate how you react to a situation.
Jake, I want to ask you, in your practice, is something that you experience among millennial men anything related to sexual identity or gender identity? Is that something that comes up in your practice?
From time to time it does, but I would say I don't often end up with those guys in front of me. I do end up with a lot of guys who are married to a woman and in that type of relationship. But I think the identity around I'm trying to figure out the right words to say that. I feel like the identity around what I really enjoy sexually and being able to explore that does come up, but not to the extent of really going deep on that.
Okay. And how about for you, Neil? Does that come up in your practice, sexual identity and those types of conversations in terms of mental health related to men?
Not specifically in my practice. We have some great specialists, even urologists, that work in that space. And so there are a lot of opportunities for patients to get plugged in with them or also in the community.
Okay. We have a clip now, another clip from Kenny, from our coordinating producer, Drew Mazias's conversation with him, talking about the lessons that he's learned in therapy and the impact on his life and relationships. Let's hear that now.
Changed my life. I explain it to my family and friends who don't really understand. They didn't know how much I was struggling, so they always knew me, and they still do. I'm still me, but I just had no idea what I was capable of. I had no idea the depths of emotion I could feel and express, and I had no idea that missing those was holding me back from utilizing my own brain to have relationships and opportunities. My life wasn't bad, but it just was nowhere near as good as it could have been for so long.
Jake, in your practice area focusing on millennial men, is there something you'd like to say to that particular group when it comes to reluctance to seek treatment?
Yeah, I would say experiment and give it a try. Hearing these clips, I I was the guy who had people in my life telling me I needed therapy while I was, a master's level therapist who could never think that he needed his own therapy. And then I started going to therapy, and I did not vibe with the therapist I was working with and decided I didn't need it. I then ended up locked in a hospital with some suicidal ideation, and thankfully found a wonderful therapist who I connected with. And again, to that clip, right, I started to realize all that I could do as I started to learn more about myself. It's not about being broken and coming to get fixed. It's about being able to optimize everything that I am and that I want to do. And, I think today, when I'm a 36-year-old talking to you all, I feel more like myself than I ever have. And a lot of that is due to the mental health work I've done on myself.
Walter, what would you like to say to people who might be hesitant to come into ghetto therapy?
That is more forms than just one therapy. A lot of the times we think that mental health counseling it's a stigma that you're crazy and that you're sitting in front of someone who's jotting down your information, going back to the office and they're gossiping, but that's not true. There's Reiki, with the one that I love the most, massage therapy, sound frequency. There's many forms of therapy to help you get through the day, and that, utilize those forms. This is free. You know what I'm saying? You come to ghetto therapy, it's free, it's open to the public, and you can come learn new coping mechanisms instead of just one. And therapy isn't a bad thing.
Jessica, can you talk to us about some of the positive influence you've seen from students who are participating in the peer-to-peer program?
Yeah, some wonderful outcomes that have come out of the program is that when we survey the students and compare the data from the end of the school year to the beginning of the school year, we're seeing significant results in terms of students having more awareness of what symptoms qualify as depression or anxiety instead of like the main ones that they're familiar with. We're also seeing that more students are understanding the severity if a peer shares with them any suicidal thoughts or that they have a plan. They are all reporting a higher percentage that they would go to an adult and they would not keep that a secret. So they're understanding that this is very serious if a peer opens up to them, which is often, it's likely to happen before that peer would open up to an adult. And additionally, we're seeing really positive results in the direction of feeling more connectedness and belongingness in their schools and being more aware of the resources, particularly the crisis line 988. Our students are sharing that number and explaining to their peers the difference between 988 and 911 and being able to connect them with that resource that they can access 24/7.
Okay. And Neil, quickly for you, anything you want to say to people who might be hesitant to seek medical treatment?
No, I think there's a lot of overlap between medical treatment and men's health. I think the mind can have a major influence on a lot of other factors, and it's important to get taking care of both issues.
I want to thank our panel for being with us today. We have Jake Ross on the phone, licensed independent social worker and owner of the Ross Wellness Group. Jake, thanks for being with us.
Thank you so much for having me.
And then here in studio, we have Walter Patton, Executive Director of Ghetto Therapy. Thanks for being here, Walter.
Thank you.
Thank you to Dr. Neil Parekh, Clinical Assistant Professor of Urology of the Cleveland Clinic. Thank you so much.
Thank you.
And Jessica Vasquez, Prevention and Wellness Manager of the School Health Program at Metro Health. Thanks, Jessica.
Thank you for the opportunity to be here.
We'll take a quick break now. When we're back, we'll bring you an interview with best-selling author Thrity Umrigar on her new book, Missing Sam. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back. You're with The Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for staying with us. Northeast Ohio writer Thrity Umrigar has written several best-selling novels, and her latest is about a woman named Sam from Cleveland Heights who goes missing on an early morning run. Her wife, Ali, is rocked by her disappearance and suspected by some in the community. IdeaStream's Carrie Wise spoke with Umrigar about Missing Sam, which explores how prejudices can run rampant in the wake of a tragedy. Now, we can't take your calls because this conversation is pre-recorded, but we do welcome your questions and thoughts. You can email those to us at soi@ideastream.org. Here's that conversation.
Thrity Umrigar enjoys taking early morning walks, and those walks inspired her latest novel, Missing Sam. She was struck by how empty suburban streets can be at certain times of the day, a stark contrast to the streets where she grew up in India in what's now known as Mumbai.
It still sometimes feels strange to me, almost unnatural, how deserted our urban, suburban life is. So that was the germ of an idea. But then I started sort of fleshing that out a little bit more. And I thought, wouldn't it be interesting if this person has a spouse or a partner? And what if that person happens to be female? And then, so they would be in a gay marriage in this case, in the instance of the book. I tried sort of turning up the heat, if you will, when I was conceiving of the plot of the novel. What would happen if the partner who's left behind also happens to be brown, happens to be Muslim, happens to be the child, the daughter of immigrants, And I just wanted to test, I guess, the bonds of Samantha and Ali's relationship. I wanted to test the strength of their marriage under the most extreme circumstances. And then, frankly, I also wanted to test the strengths of our democracy in this age of polarization, in this age of social media where, anybody can be anonymous and say anything they want about another human being. Where does that leave us as a country? Where does that leave us as a society? And most pertinent to this book, where does that leave us as a community?
Talk a little bit about Sam of Missing Sam. Who is this woman?
Sam she's white, and I only say that because that plays a role in this book. She is the daughter of an abusive and alcoholic father and an extremely timid mother. So she grows up with this instinct to always protect herself, to defend herself. And she's a guarded person in some ways. Her father has publicly humiliated her mom in many ways throughout her childhood. She's internalized the messages that has given her, and it's made her this rather possessive and jealous person, which in the context of the book really plays a role in what happens.
And talk a little bit about her partner, Ali.
She has an extremely loving father, but she is estranged from him. Her mother dies when she's 10 years old. So for all practical purposes, she has grown up with her dad, but she comes out to her family when she's 14 years old as gay. Her father is a conservative Muslim. He cannot make peace with that, and that has caused a great sort of estrangement between the two of them. But as the novel proceeds and the pressures grow on Ali, it's like incoming fire from all sides. She finds herself turning to the most unlikely person, which in this context happens to be her dad.
Yeah, crises can bring people together. Talk a little bit about how the news and social media really does some harm to the wife, Ali, when Sam is missing. There's rumors and speculation.
Those were exactly the words that I was going to use, right? This is all conjecture. This is all rumors. It's all speculation. And frankly, it's a bunch of anonymous people perhaps wanting to feel good about themselves by playing sleuth, by playing detective. I mean, there's this line in the book where somebody is actually flying a drone above their home in the hopes of, I don't know what, spotting something that would help them frame Ali as having something to do with her wife's disappearance, which of course she does not. But it's those kinds of attacks more than anything else that really are the toughest to deal with, because it's one thing if a friend or a neighbor says something to you, you can respond to that. But when it's somebody hiding behind a shield of just being anonymous, random strangers making up stories about you, she finds herself at a total loss as to how to deal with that. And I'm just afraid that we are seeing more and more of that. We are all creatures of social media these days, and we see how easy it is for people to say the nastiest of things, things that they would never say to somebody's face.
Have you ever known anybody to go missing? Or were you imagining this through the characters?
No, I personally, thankfully, have never known anybody to go missing, and I hope I never do. I can't imagine the pain of that. I've read enough newspaper articles as well as fiction on the subject to know that it feels unthinkable and awful.
Now, the book is set in Cleveland Heights with plenty of local tidbits for people who are from Northeast Ohio. You could read about Mitchell's Chocolates or the Shaker Lakes and pick up those familiar places. Talk about Cleveland Heights as the setting for this book. Why Cleveland Heights?
Two reasons. One is because I simply love Cleveland Heights, and it was the fun part of the writing of this book for me. I loved mentioning my beloved Cedar Lee movie theater. I loved mentioning Stone Oven, the bakery, just things like that. That was fun for me to do. But also because Cleveland Heights has this reputation of being an extremely liberal place. And that's where I decided to place both my characters because I wanted to test the limits of liberalism. I wanted to test the limits of allyship. Are you going to remain somebody's friend or somebody's ally when the going gets tough? I'm more interested as a writer in these kinds of nuanced, complicated conversations. If I just set, these characters and say rural Ohio, I'm afraid that everything that I write about might have appeared to be more stereotypical or more one-dimensional. But by setting it in a city that claims to be a kind of liberal bastion, it just felt, in a literary sense, it was more challenging and more interesting to me.
Were there any surprises for you with your characters as they unfolded for you?
Boy, that's really an interesting question, and one that I would have to think about a great deal more. I think the biggest surprise in the book is when Ollie and Sam sort of both realize their responsibility in setting off the inciting event that triggers, Sam's disappearance and then the aftermath of that for Ollie, when they each finally begin to realize what role they have played in that event. And I don't think it's one singular aha moment for either one of them. I think it's a gradual understanding that in any marriage, there are going to be challenges, there are going to be difficulties, and the trick is to not run. And I realize that's an awful pun in the context of the book, but I think the trick is just that resilience and that staying power. Sit still and wait for that horrible moment to pass. I think that in the writing of it, I'm not sure that it was a surprise, but it was gratifying for me to see these characters learn something about themselves.
Now, I know you're writing to stay true to your characters, but are there conversations that you're hoping that the book is going to bring about for the readers?
Well, that is always the hope, but I've always said that the book is a dance. I've done my part of the dance. Now it's up to the reader to bring in whatever life experience they've had up to this point into that dance. But yes, I mean, I hope it sparks a conversation again about what I just said about marriage, about relationships. I hope it sparks a conversation. There are millions of people who are estranged from their parents. If it can spark a conversation about owning up to whatever is yours, but also reaching out to the other person. I understand that that's not always possible, that there are many circumstances where it's toxic to seek that kind of reconciliation. But if it's not a toxic environment, then maybe so. And lastly, but not leastly, I hope it sparks a conversation about race and immigration and how we treat immigrants, how we treat people who have chosen to be in this country? Do we value them as much as they value us? And I'm saying them and us, realizing that I play both roles here, as an American, but also as an immigrant American. So I definitely hope it sparks a conversation. And finally, and this might sound like a little thing, but how we ourselves conduct ourselves on social media. It's really easy to just dash off a snarky response to something that we might disagree with. But are we chipping away at our democracy, at sort of the civil society that I think most of us cherish and value each time we do so?
As you launch the book, you get to talk to people out at events and that sort of thing. How do things change as you talk to people who read your book? How does that change for you once the book is out?
My ownership in the book ends the day it comes out. That's when the readers take hold of the book and they own the book then. I believe that it sounds like a sort of corny thing to say, but I truly believe that at that point, it's no longer simply my book. It's now a shared thing between me and the reader. I love doing public events because it's my only chance, really, to talk to readers and to hear their reactions. And honestly, this sounds like a cliched thing to say, but readers find things in my books that I'm not even aware of. It's that level of intelligence and brilliance and insight that I really thrive on. They make me see my characters and small details in the book in ways that I hadn't seen it when I was writing it. Because when you're writing it in a kind of white heat, and you're not pondering every line, every sentence, every development in the book. So when readers point out something that has not occurred to you as the writer, it's a real joy.
That was Carrie Wise with author Thrity Umrigar. To get the last word on today's topics, you can email us at soi@ideastream.org. Yesterday, we had a conversation about Greater Cleveland RTA's plans to turn West 25th Street into a space where there are 2 dedicated bus lanes. We got the last word in from Audrey in Cleveland Heights, who wrote and said, I have taken Uber and Lyft to West 25th Street, and the area could seriously benefit from a designated drop-off location so that cars don't block traffic on the road as they drop off people. Thank you for the perspective, Audrey. I want to remind everyone we have our upcoming community tour on February 17th. Check that out at ideastream.org/SOI. On tomorrow's show, we're talking about Northeast Ohio reaction to ICE activity in Minnesota. I'm Stephanie Haney. Thanks for keeping the conversation going. We'll see you back here tomorrow.